keeping supply chains open, and scientific cooperation, all of which can be well. Austria, who has succeeded in suppressing the coronavirus with just 493 active cases as of this morning, is the latest member to be invited into the group this week. Overall, to date, there are 7,221 coronavirus infections reported in Australia, which has a population of 25,499,884 in its 2020 census. This equals to a very minute figure. To date, they have only 102 deaths. Around the world, there have been over 6 million confirmed infections and more than 300,000 confirmed deaths. This fatality rate has been compared to other deadly events, and in America, the projections have been said to be as deadly and in some cases deadlier than some of the worst battles in the U.S. history. With that perspective, it is a blessing to be able to say that in the Cayman Islands, we have had no community-acquired deaths. This is a wonderful record we intend to keep. However, the next challenge for many other countries, including our own, is how to reopen parts of the economy without prompting a dangerous, the so-called second wave, something parts of Asia are now having to deal with. It is important to note that countries who were once applauded for being a first mover are now also amongst those suffering from second waves. We all want to rebuild, reopen, and restart the economy, but we must not return to a lockdown situation as we have witnessed in other countries, whereby opening too quickly, too soon, caused a second wave of increased numbers of cases and caused more loss of revenue for businesses and government. And even though we want to see families and friends together again, for example, at restaurants and retail stores, or going for staycations, we must remain vigilant. We cannot become complacent. We must follow the guidelines painstakingly put together by our medical experts, policy advisors, and by our cabinet. It has been proven that following the prescribed protocols has been creating healthy communities in our other countries, and we too can remain healthy communities in the Cayman Islands if we work as a team. Going forward, we must accept a new normal, and that includes the continued use of social distancing or physical distancing, mask wearing, proper sneezing and coughing hygiene, proper hand washing hygiene, the use of hand sanitizers, the continued sanitizing of groceries, not only towards of the novel coronavirus, but other possible communicable diseases. As Minister of Health, I'm encouraging business owners or employees to put in place internal company policies which encourage physical distancing of the prescribed 6 feet inside their properties and guidelines that require employees and customers to wash their hands and to cover coughs and sneezes through their masks in any shared space. Employers will need to consider how to manage safely the process of returning employees to the workplace. I dare say it is the responsibility of business owners to take time to educate and train staff of health and safety measures to reopen their businesses. Here are 7 steps to ensure a business follows the government's health and safety measures in the event of the spread of COVID-19. Conduct a risk assessment, employ a health monitoring and safety management system, reduce physical interaction and ensure safe distancing, ensure safe distancing while using shared transportation, provide PPE and encourage good personal hygiene, ensure cleanliness at the workplace premises, perform health checks and implement protocols to manage potential cases. You can find a detailed guidance on the government website at www.gov.ky/coronavirus. I'm urging employers for the health and safety of employees and customers to ensure workspaces are routinely sanitized and to continue using video chats or other technological advances that have made it easier to meet virtually and put less people at risk of contracting the virus. Employers, I'm also asking that the foreseeable future, you can consider in an in-place work-from-home status of any staff who can do so. Once again, all employers will find health and safety measures, guidelines, as well as other resources for reopening your business on our website at www.gov.ky/coronavirus. In closing, I have some additional shout outs. As many of you know, this past Sunday was World No Tobacco Day, as mentioned earlier. I would like to applaud the work of the Public Health Department for their relentless efforts in offering ongoing anti-smoking intervention and support programs to the residents of the Cayman Islands. The National Drug Council for their close collaboration with the at-risk youth in our schools across the islands, educating them on substance abuse. The Cayman Islands Cancer Society and the Cayman Heart Fund for all the work in the community through education and public outreach in tobacco smoking. Finally, I encourage everyone, youth and adults alike, to become educated, increase your awareness of the dangers of smoking, share your knowledge, and let's create a tobacco-free generation. Please stay safe out there. God bless. Thank you.
Thank you very much, Minister of Health. We're going to go now to Reshma from the Cayman Compass with the first question for Dr. Lee, and then we'll go back to the panel after various questions. Reshma, please go ahead.
Thank you, Donna. Good afternoon, Dr. Lee. Just a couple of quick clarification questions for you in relation to
Reshma, I'm sorry. Can Dr. Lee say something first?
Oh, sure.
I do apologize for interrupting, Reshma. If I just make a quick statement, that'd be helpful. I forgot to give you the figure that everybody was waiting for today, which was how many positives there are. So of that 59, there was one positive, an assumed community-acquired case. I thought I might also take the opportunity to say that overall, we have had 7 children who have been positive for COVID-19 during this episode. And also to say that at the moment, when you may sometimes see public health going out into the community, they do so when they are screening for people and when they're collecting samples as part of the screening program and collecting samples as part of the contact tracing. So that's often the case when you're seeing people in the community. It doesn't necessarily mean that they're going to a house where somebody is suffering with COVID. They could just be collecting the data that we need to have in order to keep the community safe by outreaching our screening program and also doing our contact tracing. Sorry, Reshma. Thank you.
No problem, Dr. Lee. Thank you for that. It eliminates some of the questions that I had to ask. Just on the 9-year-old that you announced today, is that the positive case from today? Because yesterday, when you released your report, you indicated that there was one case that was asymptomatic in that total. So is it the same case?
Not asymptomatic.
I'm a little bit confused. Yesterday, there was a case that was reported that was positive, that was the child, as well as the other positives that were reported. And that child is symptomatic, has symptoms, and continues to have some symptoms.
Okay, so this is a second child you're reporting today?
No, I haven't reported a child today. I beg your pardon. I was just letting you know about the details from yesterday's report, so giving you a little bit more facts on that.
Okay, great. Thank you. That makes it a whole lot clearer. Now, you said this is a community transmission, right? This child, is it the youngest case that we have on island of the 7 children that you've shared?
I'd need to check with public health the ranges of the ages that we have reported.
Okay. Now, since we're talking about children in general, we've gotten a lot of messages from parents who are concerned about the mental health of their own children who are going through this 11 weeks of lockdown with the entire country. From your own medical perspective, is there any advice or any sort of guidance that you can give to parents who are dealing with children who may be experiencing mental health challenges in coping with the lockdown?
I think this is something that's, affecting children right across the world because a lot of them are being basically having to entertain very unusual circumstances, and it's very difficult for the families as well as obviously for the children. We really look forward to a time when we can let the kids go out to play and be together again. And we are actively making plans for that. We've also been in discussion with perhaps having a mental health symposium similar to the clinical symposium that we had a few weeks ago with the doctors, but really with regards to mental health and also with a focus on the children. And that's something that I've started discussions about as something that might help people experientially and also perhaps to get some professional guidance about that. So I'll come back to you with that in due course.
Okay, thank you very much. Now, my questions are to the panel, but I believe that Wendy has a question for Dr. Lee, so I'll just let her ask a question and then...
Thanks, Reshma. We'll come back to you in just a few minutes. Wendy, please go ahead for questions for Dr. Lee.
Thanks, Donna. Can I just clarify, Dr. Lee, the child, when you say it's symptomatic, has the child been admitted or is it just minor symptoms?
The child was not admitted, merely treated as an outpatient basis, but at the time, many people passing through healthcare, if there's any possible suggestion that they may be COVID-related, they'll automatically get swabbed. So that was, in some senses, a routine swab, although, especially in children, you can present with the somewhat atypical, not necessarily the same symptoms. So the doctor's guard is always up very, they're on notice about checking to see if anybody might be presenting in an odd way.
And that child was not a contact of its parents, for example, that were positive or has come back in and has been in quarantine or anything like that. It's just a random one child in a family.
Yes, we're still collecting the information, so I don't know. Clearly, that's an interesting thing to let you know, and I haven't got more details for you at the moment.
Okay.
We will have those details, but it wasn't a traveller, no.
Okay, because obviously people are going to be interested as to how a child would acquire it when, especially if their parents don't turn out to be positive either. Yeah.
I think we're all very interested. We're all very interested in that, and I'm really keen to find out myself too. So.
Can I just also check, of the other 7 children that you say that have contracted the virus, have any of those been symptomatic at all?
Some have had mild symptoms. I know of at least one family where that's been the case, but I'd need to look at the details of the cases to give you more on that. I don't have it to hand.
Okay, but as far as you're aware, none of them were serious?
No, none of them were serious.
Okay.
And when a doctor says serious, they mean would need to be admitted to hospital. Yes.
Yeah. Okay. Also, is the status still the same on all of the other cases that we have? That there is no admissions in the hospital and nobody is critically ill or very ill? That
is correct. We only have the one symptomatic person, and there are no admissions.
Okay. So when you say there's just one symptomatic person at the moment?
Yes.
And that's the child?
Yes.
Okay. So everyone else, so all of our active cases are asymptomatic now?
Correct. As I gave out in the figures, 1 symptomatic, 72 asymptomatic, none admitted, 77 recovered.
Okay, great. Just my final question, which is about the blood tests, which I understand are coming now. Can you give us some idea as to what government or what the Public Health Department will be able to do with the results of those tests, seeing how that we still don't know yet how long, if any, immunity is conferred on people by actually contracting the virus? Can you give us an idea of how these blood tests are going to help us?
I think the most important information is for us to know how much penetration of COVID there's been in the community. That will probably enable us to understand whether there's any sense there may be some herd immunity. If we find out that 80% of people are IgG positive, then there's been a huge amount of penetration. If we find out there's only 10 or 15%, then that's more likely as what I think it's probably going to be a smaller percentage of the population. That may well guide our decision as to how relaxed we are about opening up. Because if there's clearly been a huge exposure that we don't know about, then that may make us more relaxed, although I don't think that's going to be the case. So that's in essence what we're looking for. And the only way we can do that is to sample a large proportion of the community. Unfortunately, with this particular test, it will need to be drawn blood. So I'm hoping people will help us with that.
I was going to say, have you got any plans yet as to how you're going to work out who gets tested, or will it be just a straightforward volunteers step forward?
We definitely don't want it to be a step forward, because that will always give you a skewed bunch of people who step forward. What we're going to be doing is we are already liaising with the Economics and Statistics Office for them to provide us with the sample that we will, and we will use that sample to help us to get the people to come forward to be tested. However, there will be a proportion of people who we will test in any event who will be the frontline healthcare providers.
Okay, that's all I have. Thank you very much for that, Dr. Lee. Appreciate it.
Thank you.
Dr. Lee, I do have one question before we go back to the panel. The one question relates to the Kim and Brack. Any further tests happening there? If so, how many? Do we have any date?
Dr. Velasamy is normally very good about giving me an update, but I haven't had one today. Okay. I have actually talked to him, but haven't had an update on the exact figures at the moment. I apologize, but I'm sure he'll give one before tomorrow.
Okay,
by
Friday.
By Friday, yeah.
Okay, thank you very much, Dr. Lee. Are we going to go back to the panel for some further comments?
Yeah, Donna, thank you. Could I just clarify? I think when I made my comments about the BA flight, I said it was sold out. It is sold out from here going to London. It is not sold out coming from London to Cayman. So if there are any Caymanians in London whose blood pressure has just gone up, I apologise, but there are plenty of seats available on that flight coming to Cayman.
Thank you, Your Excellency. Okay, we're going to begin the panelist questions now, starting with Reshma from the Compass. Reshma, please go ahead with panelist questions.
Thank you, Donna. My first question goes to the Premier. In relation to the results today, Premier, given the undertaking that we've gotten with the results and the findings that Dr. Lee has shared, does the government feel comfortable in unlocking the economies of Little Cayman and Cayman Brac as Cayman approaches the 30% threshold of testing the population? And by that, I mean expanding the bubble to open up inter-island travel. If not, when do you see that happening?
I've had these discussions with the Deputy Premier as recently as yesterday. And again, we'll be guided, continue to be guided by the medical advice that we receive. But at the moment, what is being contemplated or considered is simply expanding the bubble to Cayman Brac and Little Cayman. Grand Cayman is not at a place now where I think the Cayman Brackers or Little Caymanians would welcome open borders, because we are still seeing significant numbers of positives come through. And I'm not sure what the percentage is, but I figure we must be at about 18% of the population here. So, but as between Cayman Brac and Little Cayman, Cayman Brac is approaching 50% of its population. We tested, Little Cayman is at 100%. So those discussions will go on over the course of this week, but I see it initially as being Cayman Brac and Little Cayman, allowing travel between those two. I think opening the borders to people from Grand Cayman generally is still some weeks away.
Okay, and would you be contemplating quarantining individuals should you get to that point, or when you get to that point, rather?
What point?
Of opening the inter-island travel. Would they have to be quarantined when you open inter-island travel?
Between Cayman Brac and Little Cayman?
When you open Grand Cayman to allow free travel in the coming weeks, as you said, would that require any level of quarantine for those who are going from Grand Cayman to the smaller sister islands?
No, that's what we have in place now. There is travel between Cayman Brac and Grand Cayman, but anyone who comes here has to quarantine. There's usually people traveling from Cayman Brac to Grand Cayman for funerals or for hospital visits or whatever the case is. They have to be quarantined before they go back. So when we're talking about opening the borders, it would mean the quarantine would be a thing of the past. At the moment, there can be limited and is limited travel between the islands, but anyone who is going back has to go back in a sanitized state, to put it that way. So they have to be quarantined for 14 days and travel directly from the isolation facility to the plane and back to the BRAC or Little Cayman, as the case may be.
Okay, understood. I'm just curious, does government have a population estimate that it's working with at this point in time, any population numbers in relation to Cayman's overall estimate? Is that something that is available? And what is that figure?
No, I don't think an official exercise is done. I think we've done some basic arithmetic. We know how many people have gone back on evacuation flights. I think we have the numbers for how many people would have left here in the immediate weeks or the weeks immediately before the lockdown. But we do not have an actual estimate, like one carried out by ESO, for instance. I think our guesstimate is somewhere between 64 and 65.
Okay.
But I emphasize a guesstimate. It's not something that's based on an actual scientific exercise or survey that's been carried out.
Okay, that brings me to my next question. We did have that planned, a national census planned for October, one that is that has been in the works for some time. Given the protocols that we have and the situation that we are in, and of course the expense that carries, would government still be progressing with the national census in October?
I haven't heard word otherwise. October is still a ways away, and the way that things are evolving around this epidemic are now moving pretty quickly and in a very positive way, although there remain concerns in many quarters about a possible second wave in September. We hope to have insulated Cayman from that possibility. We never had a first wave to start with. As Dr. Lee has put it, we had a ripple, and we're doing everything we can to avoid that happening here. But assuming things are or continue on the present trajectory, I wouldn't see any reason why we couldn't proceed with a census in October. In logistical terms, whether we want to do it then, given the rather artificial state, if I may put it that way, that we'd be in with borders closed, is another matter. But those sort of issues haven't been pushed up to the caucus of the cabinet yet as to what the people who are the officials involved are thinking.
Okay, great. Thank you for that. My next question goes to the governor in relation to the BA flight. We've had some passengers reach out asking if there is any consideration to allowing additional luggage on the flight. They've been informed that only one piece of luggage is allowed. Is there any guidance that you could provide for them? Any advice that you can provide for those who are basically packing up their lives and heading to the UK, or for those returning to the UK for school or whatever the case may be?
I mean, I haven't got those details to hand, Reshma, but I'll take that away and we'll put something out, or probably on social media after this press conference on that.
Okay, great. Thank you. And just staying with the evacuation flights, is there a specific criteria that is being used or for people who are seeking to get on these flights? For example, are there any fact-checking, cross-checking to ensure that these flights are being used for evacuation flights and not for possible leisure trips for people who may come back and then quarantine government facilities? It's a concern that has been raised by a couple of members of the public to me. So can you tell us that process will go on to these flights?
I mean, I think people's reasons for travelling, it's a wide range of different reasons. There is clearly a great number who are leaving the islands, but there are some who at some point will have to come back. But those that remains challenging because of the need to isolate and the availability of space in the facilities. But we have simply used the details that have been placed on the travel helpline. Everyone who's wanted to travel has had to register there. So the people who have registered there are the ones that are going on the flights.
Okay, thank you. Now, a couple of students from the US have reached out who are here on island, expressing concerns about their ability to get back to the US for the sake of gathering their personal belongings because of the situation with the schools there, the rioting, those various things that are happening in the States. And they've reached out and asked if there's any special provisions that is going to be made for students in particular who would need to do that sort of exercise, getting back to school, preparing or packing up and coming back to Cayman. Would that be something that is being contemplated by government?
I don't think there are plans to make special provisions for that situation. I understand that that's difficult and challenging, but there are regular flights to Miami, and people are advised to go to Miami and then go on from Miami to other destinations. And then if people need to come back, the policy at the moment is that they would need to self-isolate for 2 weeks in the government facility. So that's the position as it is today.
Okay, thank you. My final question, I don't know if Premier would be able to answer this, but I'm going to ask it anyway. CXC has issued its timetable for exams starting July 13th. Would you be in a position to update students on what the process is going to look like for them? The social distancing, those are some of the concerns that are being raised in relation to them writing exams.
Okay.
Sorry to put you on the spot.
No, yeah, I'm going to be on the spot. You know me. If I don't know the answer, I'll tell you I don't know the answer. I saw Dr. Lee.
We're not laughing.
Dr. Lee moving around. I saw Dr. Lee moving around there. I thought he was going to volunteer, but apparently not. But no, I don't have those details at all. But I can ensure that we get them and that gets put out. I'll ask the Minister of Education to get on that and ensure that the department gets that information out there ASAP.
Okay, great. Thank you very much.
Okay, thank you, Reshma. Dr. Lee, you have to say?
Hi, I just wanted to give an update on the figures about the children, just as it's pertinent and current. That 3 of the 7 children, including the child that we're talking about from yesterday, have had symptoms relating to COVID. So 3 of the 7. Thanks. Thanks, Dr.
Thank you very much, Dr. Lee. Okay, we're going to go now to CNS, to Wendy. Wendy, please go ahead.
Thanks very much, Donna. My first question actually is for the governor about the Jamaica flight. Does he have any numbers on how many people are anticipated to be leaving on that flight?
I don't have an exact number, Wendy, and all those arrangements are being handled by the Jamaican consulate here, so it's not really for us to say. I think you'd need to contact the Jamaican consulate on that. I mean, it will be bringing back a number of Caymanians from Jamaica. I think that's sort of 20 to 30. But you'd have to speak to the Jamaican consulate on the outward people.
I appreciate you're not involved now, so you might not be able to answer this one either. But do you have an inclination that there's likely to be more flights now that Jamaica have opened up the borders?
We certainly hope so, and I think that is our expectation moving forward. And we're certainly very aware there are a lot more people who would like to depart. So we'll certainly be doing everything we can to make that happen.
Okay, thank you very much, Governor. And for the Premier, the first one really is just, is there any central place or a particular link or website other than the formal regulations that outlines what's currently allowed now and what isn't? Because there does seem to be a little bit of confusion over the latest changes, as well as the changes coming up on the 7th. I think there's been some people are already thinking that what's going to happen on the 7th is already allowed now, and various, we've had people saying that on Cayman Brac, people are diving, and here in Grand Cayman, people are now sailing. So there's too many questions about what isn't allowed to ask at these briefings. So I just wondered, is there a central place that we can direct people to get these questions answered?
Yes, all of the information is there in stark terms on the website. It is easy to access. It's easy to read. But a lot of people are, I think, being a bit, shall I say, aspirational about what they think ought to be allowed and what not to be allowed.
Yeah.
I've actually put out my own notes, which are in wide circulation as well, and those are up on the Office of the Premier's website. But I keep getting the questions too, Wendy, so I know what you mean.
Yeah, I was just wondering if there was whether it's where it is, because is it on the coronavirus on the Explore Gov website where it says exactly what businesses are open and what you can do and what you can't do?
Well, it doesn't say what businesses are open. It says what type of businesses.
Yeah.
Yes.
That's what I meant. Yeah.
Yes, it's there, and as I said, you can go to the Office of the Premier's website as well. It's there. The actual regulations are up there as well as the explanatory notes. And the communication team at JS have been doing an excellent job at putting out their usual communications. It's all over the place. I mean, I get multiple versions of it. Some of the stuff that was published in the media was not entirely accurate, which didn't help at all either. But I fully understand. I mean, this is a moving feast. It's changing all the time, and you know, it's difficult to get it all right. But it's all there if people take the time to go have a look.
Okay. The other question is about the letters. You said earlier that
About what? Sorry.
had given out about the exemption letters. You said that 300 had been issued. I'm taking that since you introduced the new shelter-in-place order since Friday. So there's been
Right. So
300 letters
that's
since
construction and retail and realtors. Yeah.
Okay. Can you give us an idea of how many people have actually asked for it? Because we're getting so many saying that they're still waiting on letters. So I'm guessing the numbers must be quite high. So it'd be a good idea to put that out there so people understand why they might have to wait a day or two.
Well, since the regs only came into effect yesterday, I think that's not a pretty bad record. But I don't actually know how many applications.
No, that's what I'm saying. So do you know what the number of applications are that have been, the number of people that have come forward and said, I want a letter, I want a letter?
No, I don't. I don't. So you remember now that we opened part of construction last week. So this is the other, or 2 weeks ago, I've forgotten now, but yeah, 2 weeks ago. So this is the other bit of construction, 2 weeks ago. So this is the other bit of construction now with with retail and the realtors added to it. But it all seems to be going pretty well. I mean, I think I have a pretty good feel for it because I get hundreds of messages a day, and so I kind of weigh how well or not we're doing based on the number of complaints I receive in any given day.
But it's safe to say that you probably had hundreds more requests that you've got to deal with.
I don't want to speculate.
Okay.
When I just don't know. I only know what I was given when I came in this morning, and they gave me the actual numbers of ones. Up until I came here, there were 260 retail and 47 realtors in that number.
Right. Okay, my last question is about the work permit holders who will be returning and what the protocols are around that. Have we sorted, is that actually happening yet? Like, are bosses now allowed to bring new permit holders who have been granted a work permit from overseas and returning work permit holders and to go into quarantine? Are those quarantine facilities available yet? And if not, when will they be available?
Well, it's certainly permitted. I don't have any information about whether people have actually come, but it's certainly permitted. We made the announcement weeks ago. Obviously, if it is someone who already had a work permit, there's no issue, because the work permit would have been granted already. Your question is not about persons applying for work permits at this stage, is it?
No, it's about the quarantine facilities for those that are going to have to pay themselves.
Right. So I don't know if Danny can help with the details on this. I just don't have
Okay.
that level of information. And I hate to speculate. The question is, this is for the benefit of Danny. The question is whether or not the isolation facilities for persons who are paying for themselves, who come back, for instance, as work permit holders, are they ready? And if so, to what extent has that facility been utilized?
Thank you very much, Wendy. We are looking right now into increasing the shelter capacity in the isolation facilities. There is obviously some high-level decisions to be made as to what the future of that looks like. But again, the priority has been given to Caymanians and permanent resident holders. But again, most of it comes down to how many people we can get into those facilities, given that obviously that's not an unlimited number of people to get in there. So it's a work in progress, but at the same time, we do appreciate, there's a big cry for people to come back to Cayman, be it work permit holders and Caymanians and permanent residents who want to come back, and we're just doing our best to make sure we can give them a room to stay at the inn for the 14, 15 days required, and then the test.
Okay, great. And Danny, thank you very much. I appreciate
Thank you.
Thanks, Danny. When they,
Yep.
my efficient team at Curfew Time have sent me the information. They're listening keenly. 61 applications are currently outstanding. All will be addressed by the end of the day. As of May the 1st, we've had over 4,000 applications. Requests are considered within 2 business days, with most receiving a response the same day. So they're doing a pretty good job, I think.
Thank you for that. I appreciate it. That's all my questions for today. Thank you.
Okay, Wendy, thank you very much. I have a list of questions, but I'm going to ask one in particular. A member of the public would like to know what serious procedures are in place to ensure that business owners are first employing Caymanians. As I know, that's been a big thing for you, Premier McLaughlin, as well as His Excellency, to employ those persons first, as opposed to bringing back persons on work permits. As Minister McTaggart, we know, predicted a substantial unemployment rate in the foreseeable future. So this person wants to know what serious procedures are in place.
Well, I'm not sure what is meant by serious procedures, but the law sets out what the procedures are. And we've also moved in recent times to the requirement that all job applications have to be posted on the I even forgot the name of the portal, but that has been set up by work. So everyone can go directly to that. I hope someone is listening on the team that will jog my memory with what the name of the portal is that you have to go to. So I can give that to people now, so they can go there and see what jobs are actually available, because all employers are mandatorily required to advertise there. Obviously, they're free to advertise in the local media as well, or overseas, as has been the